A recent preprint concludes that 2 or more COVID-19 reinfections double the risk for death, blood clots, and lung damage among other negative health outcomes, demonstrating the clear and present danger of reinfection. The most recent Omicron variants have an enhanced capacity to evade our innate immune defenses. BA.4 and BA.5 are continuing that trend with replication of the subvariants associated with reduced activation of epithelial innate immune responses compared to earlier BA.1 and BA.2 subvariants. With BA.5 responsible for over 54% of all COVID infections and BA.4 accounting for over 17%, the risk of reinfection is especially high even for those who were more recently infected with BA.1 or BA.2. We need to take action now to prevent reinfections and ensure that they do not cause long-term health impacts for broad swathes of the population. This is the first study to characterize the health risks of reinfection, an understudied area. The study uses the health records of more than 5.6 million people treated in the Veterans Affairs health system. The study population was broken down into 257,427 participants with 1 documented SARS-CoV-2 infection and 38,926 participants who had 2 or more SARS-CoV-2 reinfection and 5,396,855 participants with no record of positive SARS-CoV-2 infection as a control group. Among those who experienced reinfection, 36,417 people had 2 infections, 263 people had 3 infections, and 246 people had 4 or more infections. The median time between the first and second infection was 79 days and between the second and third was 65 days. The authors found those with 2 or more documented infections had more than double the risk of dying and 3 times the risk of being hospitalized within 6 months of their last infection. They also had higher risks for lung and heart problems, cardiovascular disorders, coagulation, and hematologic disorders, fatigue, digestive and kidney disorders, diabetes, musculoskeletal disorders, mental health disorders, and neurologic problems, as represented in Figure 2 below. The risks were most pronounced in the acute phase, yet most were still evident at 6 months after reinfection. Many leaders within the US and globally have currently opted for more relaxed or even non-existent COVID-19 policies, relying on vaccines to reduce the risk of death and hospitalization.